Nosocomial, or healthcare-acquired infections, are a leading cause in high morbidity and mortality rates in hospitals nationwide, with ventilator-associated pneumonia being the second leading cause in ventilator-associated events in the ICU. Many factors can play a role in patients developing some sort of ventilator-associated event, whether that be poor hand hygiene, use of contaminated equipment, or if the patient has to be re-intubated. Preventing ventilator-associated events can help our community by keeping medical care costs down by preventing unnecessary prolonged care.
An estimated 90% of adults over the age of 65 have one or more chronic conditions, such as diabetes, heart disease, arthritis, depression, and hypertension. Elders often experience appointments with multiple doctors who don't always discuss the patient's care. This often leads to confusing diagnosis, prescriptions, and evaluations, which leaves the patient frustrated and confused. The Sanford Center Geriatric Clinic can help reduce some of the stress by providing a complete health assessment of the patient's healthcare needs, just under one roof.
Arbor's memory care community focuses on giving care and having a sense of community for those who have Alzheimer's in the Reno and Sparks area. More than 5 million people are living with Alzheimer's, and it is the 6th leading cause of death in the United States. In fact, every 66 seconds, someone in the U.S. develops Alzheimer's. The cost of caring for those with Alzheimer's and other dementias is estimated to total $236 billion in 2016, increasing to $1.1 trillion in today's dollars by mid-century. In the year 2017, it is said that there is over 43,000 people in Nevada ages 65 and up that will be diagnosed with Alzheimer's.
While working with the Infection Control Department at Renown, I was able to help with a point prevalence study on what can be done to prevent ventilator-associated events. We accomplished this by auditing different ICUs throughout the hospital to ensure respiratory therapists and nurses were following proper protocol while caring for patients to prevent possible occurrence of events like ventilator-associated pneumonia. I was also able to help with a hand hygiene audit to assure those who work within Renown are taking every opportunity to practice good hand hygiene etiquette, like washing their hands upon entering patient rooms and upon leaving, including using foam sanitizers provided on the walls inside and out of each room.
Before I started my internship, I was a little nervous due to not having much experience working with the older adult population. While interning at the Sanford Center Geriatric Clinic, I helped gather clinical research, and by doing so, I conducted a 6-month geriatric follow-up survey with the clients.
Going into this internship at Arbor's, I had no idea what to expect. I knew that I had to choose a project that was safe enough for the elderly to participate in. Being that my dad is a certified fitness trainer, I figured I would incorporate some fitness into their lives. It sounded like a great plan until I tried to get a few of the residents to sit down with me and do Tai Chi exercises. They were not having it and had no interest in stretching out their arms and legs, so I shifted my project focus more so on mental and physical health rather than just physical.
During my time at Renown, I was able to make health happen in my community by helping streamline Renown's policy on protocols pertaining to ventilator-associated events, as well as helping the Infection Control Department assure those who work at Renown are practicing good hand hygiene while in contact with patients. Communicable diseases are a primary factor in high health costs at hospitals nationwide, and making sure those who are in contact with patients or are helping out those who are on mechanical ventilators are following proper protocol to prevent the spread of germs and diseases helps those who work at Renown and those from the community who visit Renown as a patient.
I made health happen in my community by talking to patients about their current health compared to their initial visit at the geriatric clinic. By doing so, I was able to help the clinic gather information necessary to help with their research, which can affect the patient's overall health and well-being. By doing these evaluations, I was able to gain knowledge on how to interpret coding, which helps keep the information organized so that the geriatric clinic can help their patients more efficiently.
I made health happen in my community by interacting with the elders that live at Arbor's memory care community. Depending on the day, I would go back and forth between mental and physical activities. Mental activities would include patients completing puzzles and basic hand-eye coordination functions, which helps their cognitive functioning. Physical activities would include them walking around the facility and doing morning stretches while sitting in a chair, which helps with their motor skills.